Good evening. I come to you with persuasion about the Unaffordable Care Act. Can we really afford not to change it? I come to you today not as an individual observations, but as an individual with concerns and experiences relating to the Affordable Care Act. I am an individual from both sides of the railroad tracks. When it comes to the Affordable Care Act and how it not only affected me, but the ones closest to me, I know what it means to be poor and uninsured before the enactment. I know what it means. I know what it was to struggle with a partner's inability to receive quality care for being uninsured for a pre-existing condition. Even now, after the enactment, being a middle-class citizen to struggle more than ever to pay for the cost of Unaffordable Care Act, because before being married and placed on spouse's employer's sponsored plan, the out-of-pocket costs were more than 50 to 20% of our income while possessing an individual policy for myself. It goes without saying. It opened the door to help so many people, but it also is failing many as well. If we do not fix just a few problems I mentioned here today, this great attempt to save the people of the United States and further ease the burdens of the middle class will certainly fail. Now, many of you, I know, are thinking about who, what, when, where, and whys to all of this. So I will go into further detail about the ACA to help you better understand the Affordable Care Act and what it was. Then I will discuss where it has failed. What is the ACA? The ACA is known as the Affordable Care Act, actually refers to two separate pieces of legislation: the Patient Protection and the Affordable Care Act of the Health Care and Education Reconsolidation Act. It also is commonly referred to as the Obamacare because who enacted it. Which leads to the next answer of who elected this. President Obama signed the Affordable Care Act, H.R. 3590, which became Public Law 111-148. When it was enacted, it was passed by Congress and then signed into law by the President on March 23, 2010. On June 28, 2012, the Supreme Court rendered a final decision to uphold the healthcare law. So where did this take place? The 50 states of the United States of America, and every state was offered government assistance and subsidies to launch the exchange in the marketplace to expand Medicaid, but many did not opt for the funding, Florida being one of these states. Why was this enacted? To protect the middle class, extend health care coverage to the poor and the uninsurable. It was appalling to think that in theory that some 129 million Americans have some kind of health condition that would cause them to be denied health insurance. To help the government, it was lower the government's deficit, lowering the number of uninsured and reduced the number of individuals forced on Medicaid for being uninsured. In 2011, the Congressional Budget Office projected that the ACA would lower both future deficits and Medicare spending. They wanted to ensure fair access to health care insurance and finally force insurance companies to make policies clear and understandable to most of all, to hold insurance companies responsible for unfair acts and unfair discriminations. Now, as I go on here today, I want to mention how healthcare changed for the better. Additionally, as I previously mentioned, the law requires insurance companies to cover all applicants within our new minimum standards. 1, it keeps young adults covered. 2, it ends arbitrary withdrawals of insurance coverage, which means insurers can no longer cancel your coverage just because you made an honest mistake. 2, the cost. It ends lifetime limits on coverage. Insurance companies now publicly justify uninsurable rates hikes. 3, it offers same rates regardless of pre-existing conditions of sex. A, meaning pre-existing conditions are the majority of an individual's needs for care. B, so many people had pre-existing conditions, leaving them with no opportunity outside of an employer's sponsored plans to obtain health care insurance. Care. It also removes insurance company barriers to emergency services. You can seek emergency care at a hospital outside of your healthcare plan's network. 4, provisions to help affordability and access. A, it gives tax credits that makes it affordable. B, it begins provisions to fill gaps that have been put in place. So with that being said, it creates a minimum Medicaid income eligibility level across the country beginning in 2014, which will give coverage for newly eligible adults with the fully funded and federal government for 3 years. 3, it allows employers to require to provide benefits in employing 50 or more individuals, protecting the employees. And it also, for some businesses, it became a requirement for full-time employers to qualify for the benefits. So what is the downside? Well, that would have to possibly be it did go away. With that being said, the cost crippling the middle class. The Kaiser Family Foundation reported an average deductible is more than doubled in 8 years, from an average of $584 to $1,217 for individual coverage. The portion of workers with annual deficit deductibles rose from 55% 8 years ago to 80% today. Now, in 2014, that was the largest one-year increase in enrollment in high deductible plans from 18% to 20% of all covered employees. That is an incredible increase. Nearly 30% of private insurers working age Americans with deductibles of at least 5% of their income had medical problems but didn't go to the doctor. Why? Because it became so expensive. Use of hospital care among insured workers has dropped since 2010, and the use of outpatient care, such as doctor visits, dropped slightly for the first time from 2012 to 2013, according to the insurance claim data analyzed by the Healthcare Costs Institute. The bottom line of this, when consumers skip care, they enter a downward spiral that impairs their physical and financial health. What about the ones that cannot afford it at all? Well, one major provision with the expansion of Medicaid eligibility, low-income individuals with incomes at or above 138% of the poverty level is for families that make $27,724 or lower on the family tree. As of March 2015, 22 states were not expanding their programs. Florida is one of these states. That is why we need to change this program today. Nearly 4 million poor uninsured adults fall into the coverage gap that results from states' decision not to expand Medicaid. Because the ACA envisioned low-income people receiving coverage through Medicaid, it does not provide financial assistance to people below the poverty for their coverage options. Because of the employer mandate, many families of working poor are not eligible for government assistance because employers are not required to contribute to the family plan. Now, let's not forget about the employees. The current employer mandate states that a loss of jobs, many small businesses have curtailed job expansion to stay below the 50 employees, which means that they don't hire more than 50 employees. So they would hire 49 or less to curtail this. Cutting benefits to existing employees to cover added costs, and changing employee status to part-time, which means that now many employers don't have workers working more than 35 hours per week. They have workers working 35 hours or less. 6 things that we can begin to fix this problem, and me allowing to be persuaded here today. Eliminating or revising the employer's mandate will allow people below the poverty level to receive a premium assistance from the government. 1, fewer cutbacks in hours, stronger job growth for small businesses, and less benefits cut back for full-time workers. We can also plan and also provide real pricing incentives for people in exchange to healthy behaviors. We can fixing these young-related pricing. 1, younger people are seeing 50 to 100% in price increase. 2, a 60-year-old will pay lower premium after subsidies for a bronze plan than a 30-year-old. The Florida healthcare marketplace has multiple plans: premium, silver, bronze, and major medical. D, fix the lack of Medicare expansion in many states and lack of government assistance. E, without expanding Medicaid, many families below the poverty level are in orphan status. F, remember that employers are not required to contribute to a family member's plans. This is an unforeseen flaw that needs to be fixed by the government's providing assistance instead. Now, in conclusion, in closing here today, as the law stands, half of the uninsured won't qualify for government assistance. So, if you can't afford it, they are stuck and can't or won't get health care, or are suffering to impact the financial consequences. 2, millions will continue to have limited, if any, options for health care coverage. 3, the middle class now has additional burdens that will transition to the poor class in no time. And my recommendations here in closing, please consider the following. A, it won't fix all the problems, but it would start somewhere if we can take what I have said here today and implement them. B, we need to fix these problems because it will continue to grow as the middle class shrinks and the poor stay poor and forgotten and the rich becomes richer. Thank you so much and have a great day.
Well, I do like
How did I do?